America's Healthcare Challenge with Sean
Joining us right
McGuire.
now on America's Healthcare Challenge, Dr. Drew Lederman. Dr. Lederman got his BA in psychology from Harvard University, with his MD at St. George's University School of Medicine, and he did his residency and fellowship at Albert Einstein College of Medicine in New York. Board certified with the American Board of Pain Medicine, American Board of Psychological, Physical Med, and Rehabilitation. Dr. Lederman, great to see you. Welcome to America's Healthcare Challenge.
I actually just came back just short of a week ago from a vacation in Florida, and we were there while things were going from, oh, look, there's a problem somewhere else in the world, to this is a critical problem right here. And so that happened all while we were there, and we got back just last Saturday, and coming back to work. Work looks a whole lot different right now, just prioritizing different things, and it's a crazy time.
Yes. So what was it like from your perspective as things did unfold? What was it like flying? I haven't talked to a lot of people that have actually flown in the last couple of weeks. Now we're seeing the airline industry, really almost on life support from our federal government. At that time, did it seem like there was as much panic as there is now, or is it, as Ron Burgundy would say, really escalated quickly?
Yeah, I mean, I wouldn't say there was panic on the airlines. There was certainly awareness. Things looked different when we flew to Florida compared to a week later when we flew back. Though both flights were full, but a lot more Clorox was going on our flight back than when we were there, going on our way there. And certainly a lot more masks than we saw. So there's no doubt this is hitting the airlines hard. I mean, with all the shutdowns, both domestically in other countries and internationally across the globe, I mean, this is hitting everything. It's not just the airlines. And I think you're seeing that unfold. Is the smallest little change just has such a domino effect to the entire economy and the entire world. It's pretty profound.
I bet you were just getting bombarded with tons of emails and correspondence and patients wanting to know what's going on, administrators trying to figure out how to handle all these things. Amidst all of that noise, what's been some of the things that have really stood out to you, as a medical professional following?
There's a lot of things. I would start off by saying, my specialty, there's sort of two aspects to my specialty. My more general specialties, you mentioned physical medicine. I have responsibilities at the hospital to manage rehabilitation patients after they've suffered, physically incapacitating medical issues like strokes or fractures and things like that. Those are people who are treated in the hospital and are there for days to weeks. And so I manage those patients. The other part of my job, certainly time that I spend most on, is as outpatient, dealing with chronic pain, specifically trying to treat chronic pain in addition to some basic pain medications, but more specifically with image-guided procedures. Now, because chronic pain, by definition, is really not an emergency, it's considered, all those procedures are considered elective. And across the country, and likely the globe, all elective hospital or medical procedures are on pause, to preserve resources, both human and otherwise, for the rest of the hospital with everything going on. So that's been sort of different. My focus has therefore shifted to the inpatient rehab side, and also helping the hospital, working in a community hospital, helping as much as I can in whatever capacity I can to free up resources and offer whatever help I can. So things certainly look a lot different right now than they did a couple of weeks ago. My typical day is seeing 15 to 20 patients and doing around 15 to 20 procedures. And now I'm doing none of that. I'm trying to help those patients through phone messages and telehealth. I'm trying to manage my as best as I can with just pain medicines as opposed to procedures. But I'm fairly limited in that sense. But I think things will be like this for a little while. I know that's up for debate how long that while is, weeks, months, but it's a new world. A lot of time to think for specialists who aren't really doing much at hospitals.
I know that Vegas is closed, which, you know, a lot of my gambling friends out there are pretty disappointed about. I noticed that they were taking bets on the weather. Or I don't know if that was a true headline. If you were to make a bet on how long this were to last, you know, as far as, you know, and we may not have even seen anything yet, because we noticed this week that New York and California, I think it's essentially, you know, calling martial law, quarantining everybody at home. How long do you think this thing is going to play out where people's lives really are disrupted?
Well, you know, I think my answer has to be nuanced. I think you have to talk about what restrictions we're talking about. I think just as you saw them, unfortunately, slowly roll out the restrictions over days or weeks, I think the same will be true on the other end. I don't think you're going to see a day where, okay, all of a sudden everyone can go out and hug each other and shake each other's hands. I think there's going to be some time before the United States sees its peak in this. I think we're still on our way. We're not there yet. I think that will be weeks until most of the country sees its peak. And I think we're talking months, you know, between 3 and 6 months to see things start to calm down and go back towards normal living. But that will exist on a gradient, and this whole push to flatten the curve, you know, you have to think about flattening the curve, and then you also have to think about the area under the curve, and they're actually the same, whether you see a high peak or a flattened curve or a broad slope. The key there is, you know, obviously decreasing the burden on the hospitals in a very short period of time and extending it over a long period of time. So I think that remains to be seen. How effective are the measures they're taking right now to flatten that curve? And the inevitable consequence of flattening the curve will be a longer duration. And so how effective are the things we're doing right now? I don't know. Hopefully people are adhering to the recommendations to really just self-quarantine the whole country. But so I don't know is the short answer. And there's a whole lot of variables that enter into the answer to that. And I think you even see the brightest minds in the country in infectious disease and epidemiology don't have the answers, and they're kind of looking to other countries who are maybe a month or two ahead of them to project what this country will look like. But obviously there's so many variables. The smallest variable can change those projections by a long period of time. So I don't know would be the simple answer.
I don't think anybody does. You know, I think if they did, they'd probably be making a lot of money if they could somehow, you know, predict this. One of the variables that could become developed, it kind of came to light a little bit, is I forget the name of the actual drug, but used to treat malaria. That's starting to see some potential impact. We don't know. It's kind of, from my understanding, it's kind of like comparing apples to oranges. When you try and compare the success that it has before, certainly sparked a contentious moment in the press conference yesterday between that reporter and the president. Do you think that could be something like a treatment like that coming to the marketplace? Do you think that could really, you know, when we talk about bending the curve, you know, have an impact should it become successful?
Yeah, well, I guess it depends on how you define that success. It depends on what level of evidence are you satisfied with before you deploy it as a mass treatment. And I think that's the big issue is, you know, there's basically 2 studies, a French study and I believe one from China as well, that talk about treating patients with hydroxychloroquine, commercially available as Plaquenil, used to treat malaria and also some autoimmune disorders now. But these were you know, non-randomized, non-blinded studies done on 20 to 30 patients max. So, you know, you say those numbers to anyone who's familiar with stats and research, it's as good as a case report, which is pretty much useless. So I wouldn't go so far as to say it's useless. It's good that it was tried and it showed some promising improvement, though if you look at those two studies, it's pretty easy to dig holes in them. I think it's certainly worthwhile entertaining, but I'm not sure it's ready for prime time to deploy as it needs to be deployed on a mass scale. So that's what I wonder. And, remember, every medication comes with risks, including, with hydroxychloroquine, prolonging a particular interval of your heart rate. And that can potentially be devastating. And if you apply that on a mass scale, who knows how many people you could be killing or injuring. You could start getting to numbers as close to what we're seeing now that the disease is actually causing. So, it's easy to get excited about those things, and everyone, they offer hope. But both the good and the bad thing of the standards the United States uses to bring drugs to, real life is that it takes a lot. It takes a lot of proof. It takes a lot of money. It takes a lot of time to prove that a medication is safe and effective. And so that's the problem here, is you're asking people to try things on human beings. And that wouldn't get past most IRBs this day and age.
Right. I got to ask your opinion on something. You were born in Canada, I understand. Is that right? From Toronto originally?
Toronto, yep.
Yeah, cool. So how would you compare and contrast the way that Canada and the U.S. has handled this issue, both kind of large geographically, obviously, so that could, I guess, be to their advantage or disadvantage compared to other nations in the world. But I noticed that Prime Minister Trudeau and his wife were quarantined, I believe. That happened about a week ago. Have you noticed any differences between the two countries and how they're handling it?
It's hard to say. The things that I notice are more so the commentary and the amount of animosity there is towards governments, which in the last few years has actually increased drastically in Canada, almost to echo similar things that happen in the United States. I think, Canada has done a fairly decent job. I wouldn't say it's that drastically different than what the United States has done. I would say in Canada's favor are things, one is exactly what you said, solely the fact that they're less densely populated across the country. Obviously there are city centers and those are concerning just as New York is, but I think that's one thing in its favor. I think, they do have socialized healthcare, which may facilitate a more cohesive approach to dealing with this. The government itself may have a little bit more control to manage this, whereas the United States has sort of a mixed system, Medicare and city hospitals and state hospitals, but also private hospitals. So maybe a little bit more disconnect. There's so many variables as to how it could play out. In terms of what's come from the brass, from the government, I think for the most part, they've echoed each other. I'm not a huge, without getting too far into politics, I'm not a huge fan of, of how the President of the United States talks about this problem and has talked about it, and I think it's not helpful a lot of times, and especially the difference in how he talks about dealing with this crisis and analyzing the crisis versus how his own experts talk about it. I think that's problematic, and that they're unfortunately very different. I don't see that happening as much in Canada, and granted, I'm not there. I'm not as exposed to their media as I am here. So, I think there probably are differences. it's tough to say. I think the population density thing is probably pretty significant, which is pretty much out of the government's control.
Yeah, and then I believe the UK just now finally shutting down bars and pubs. I believe that happened just yesterday. So it is kind of interesting to see each nation has kind of handled it a little bit differently. You know, what would you give as advice to the people checking this out for the first time? By the way, if you're watching this for the first time, thanks so much for joining us. Make sure to like our Facebook page. But, you know, should they believe that they do have symptoms, you know, what should they do?
What hospitals are trying to do now is really preserve resources and not overburden the emergency rooms. And, you know, I guess good advice would be to let people know what types of patients should be seen in the emergency room. And yes, symptoms that are common with this coronavirus include fevers, cough, shortness of breath. About 10% of the population, at least in one resource that I saw in China, at least, there were some GI distress-related issues. We're still learning a lot about this every day. But really, it's the shortness of breath that is probably the kicker and the thing that you shouldn't sit on. You should go get checked out. There are now a lot of resources. I can speak for our hospital system, but you know, across the country, that are trying to triage patients, meaning decide who should go to the ER and who shouldn't. And they're offering hotlines, either by calling your primary care provider or going through hospital systems websites that will usually offer a toll-free phone number to go through screening questionnaires. And that will help decide A, who should be tested, and B, should you go to the emergency room. So the bottom line is, if you have coronavirus, it doesn't necessarily mean you need to be admitted to the hospital. The people who need to be admitted to the hospital are really the people who have serious illness, shortness of breath probably being the most prominent with this problem, but serious illness that clearly isn't getting better. And sometimes there's gray area there, and that can certainly cause confusion, but that's what medical professionals are there for. And so they're trying to set up these ways to triage and take your questions and see who needs to be there and who's not. Because what we can't have is have the hospital system overburdened, and that leads to that spike instead of that smooth curve. And that's how people who need the care don't get their care and can die in this case. So I would say abide by the triage system that's available to you, your community, your state. And there's so many resources in social media. I'd say the positive of social media in this case is it's out there. There's phone numbers out there. It may not be easy to get the test when you think you want it, but the people who need to be in the hospital will get there. And so that's one thing I'm hopeful that the triage system is helping.
Any final thoughts, Dr. Lederman?
Well, I have so many thoughts on this topic. It's so interesting to watch unfold. But if I'm communicating with people who are looking for advice, I would say, you know, try your best to stay calm and not hoard. I don't think the supply chain, there's been a lot of talk about the supply chain, you know, things like groceries and things like that. I really don't think that's going to falter. I don't think this type of disaster, a pandemic, will result in that. So hoarding is not helpful. It only causes panic. So I don't think you should be worried about that. And even the most strict restrictions in the United States, both in California and Illinois and New York, are allowing people to leave their home to go get essentials, medications and groceries. And those continue to be restocked despite that initial surge of toilet paper hysteria. Essential goods are still available. Another big important thing, I think, is young people. I guess a lot has been written and reported about young people not necessarily taking the social distancing concept seriously. Something interesting I saw on the main CDC website the other day, they put a report at noon every day between Monday and Friday on the number of cases and also outline the age groups that are affected, I noticed that under the age of 60 were 50% of the cases that were diagnosed in Maine, 50. Now that doesn't necessarily speak to mortality. It doesn't speak to who dies from this, but it shows you everyone is susceptible to getting this, and therefore everyone is susceptible to passing this on to someone else. And that is what they're saying these days, that is the biggest issue, are these silent carriers. Even people without symptoms who have the virus somewhat so-called colonized in their system can very much transmit it, and that's a problem. So it's important to take these social distancing practice very seriously for the health of your parents, your grandparents, but even yourself. They're young people that have died from this, and fit and healthy young people that have died from this. So I think in terms of advice, those are a couple of the things that I think I would offer. My last thought is I'm fascinated and nervous about how this will change everything from finance to economics to both within healthcare and outside it. I follow LinkedIn fairly closely as it's become a big mode of communication in the medical world. It kind of lagged behind the business world, but now is pretty big. And there's been some really interesting discussions. And I commented on one about the number or the trend of physicians going to becoming more subspecialized, especially in the United States. More and more specialists are honing in on very small subspecialties, honestly, myself included, who are at home right now doing nothing, because so many of the things we do are advanced and elective. And I think something like this is going to, or may, reshape how we prioritize different types of healthcare, because there's been a huge shortage of primary care doctors and providers across the country, and especially in my home country of Canada. And this certainly will shed light on that, having so many specialists, like I said, at home looking at LinkedIn and not treating patients. So, I think that's really interesting. And my hope is that this does spur change. I mean, it brings up so many other issues. Vaccinations, are people going to take that more seriously? I think this will change a lot of things. My hope is for the better, but it's an interesting, crazy time.
Dr. Lederman, thank you so much for joining us here on America's Healthcare Challenge. Hope you can come back again soon and we can talk about some of these other things, because you're right, this thing is just beginning to start. So thanks so much for joining us.
Thanks so much for having me. It's a pleasure.